Thank you so much for staying with your Feel Good Breakfast Show, Expresso here on SABC3. So good to have you. Now, we are so excited to welcome our next guest back to your Feel Good Breakfast Show and certainly to your screens. Of course, it's the ultra cool Dr. Corinne Brink, the resident vet from Ultra Dog. And to kick things off, we're going to be taking a closer look at joint pain in pets because sadly, arthritis is not only a common diagnosis in humans, but also our dogs. Dr. Corinne Brink, it's really so fantastic to have you back. But how do we recognize joint pain in our dogs and not just assume that they're aging?
When they're aging and they suddenly become slower and less inclined to move, it is usually joint pain and it is painful. So never just attribute it to my dog is aging and that's why we see in the signs. Osteoarthritis pets will suddenly move slower. They will have an aversion to movement and exercise. They will not want to climb stairs or jump on couches or maybe jump on your bed. Stuff that I used to want to do, they would suddenly not want to do, or suddenly they don't want to go for a walk. Also, they will lick their joints where it's painful. There may be a change in behavior. A dog that was usually placid is suddenly aggressive, or a dog that was hyper is suddenly very timid and shy. There can also be yelping when you touch certain body parts, and you may also see lameness or limping. Sometimes you will see all of this together, or sometimes you will only see one of these symptoms, and this can be indicative of osteoarthritis and joint pain.
So how can we treat and manage their symptoms? Is it a combination of, say, diet and supplements that are needed?
It's usually a combination. I always tell people when you have the right diet and supplements, it will mean that the medication that you give will be lower. So if you only focus on medication, it will need to be at high dosages to reduce the pain. But the moment you add a joint-friendly diet or an adequate supplement, you will still require medication, but it will be less.
Well, Dr. Brink, we know that Ultra Dog has a special diet range specifically for joint pains, but how does this food then help with the joint pain? What's the magic ingredient here?
I must be honest with you, I'm very excited about this diet and I'm getting so much good feedback on this diet because it really helps to keep those painful animals still ultra pets and ultra happy. What is different in this diet is that it has a reduced fat percentage because you definitely do not want your overweight pets to have joint problems as well, because this will cause pressure on those joints. The next thing is we have the 3 very important ingredients that's specifically for joint health. The one is chondroitin. Now, chondroitin helps to reduce inflammation in your joints, and it also helps for joint repair. Then we have glucosamine, and glucosamine and chondroitin works together. So they have a synergistic effect, and they will definitely help together with cartilage repair and to reduce joint inflammation. And the one that makes us really stand out and is a really ultra cool ingredient because it's unique in our joint mobility range is the green-lipped mussel extract that is in our range. Now, green-lipped mussels have a very high level of omega-3s, and these omega-3s are a natural anti-inflammatory, and anti-inflammatories naturally reduces pain. So it's really a nice ingredient to have for those joints. And what is also a bonus of it, there has been certain studies that proved that green-lipped mussel extract helps to protect the tummies and will help those animals that need medication to prevent gastric ulceration in them.
It sounds fantastic, Dr. Corinne Brink. Now, this diet, can it be used as a precautionary measure for when our dogs become seniors, or is it best to only feed your dog when they've been diagnosed?
It can be used as a precautionary measure for sure. If you go and look at glucosamine and chondroitin, those ingredients take a long while to have effect. So if you have a pet that turns 7 years old and is in that senior range, you can definitely start with that diet. Or even if you have a large breed dog and you know that specific dog is prone to hip issues or elbow issues or anything like that, you can definitely already preemptively start on that diet as soon as the dog is an adult, 18 months to 2 years old.
So this next question, I know that for a lot of dog owners, it can be quite tricky here. When your dog's been diagnosed with osteoarthritis, should you be encouraging the dog to play and keep busy and moving, or should you really just be keeping it resting?
You know what, if you keep it resting, they will become overweight, and obviously there will be pressure on those joints. So the key here is moderation. You want to use the right exercises in moderation. For example, you won't want to go running on hard surfaces where there's going to be a lot of pressure on your joints. You would rather go for short walks, 15 minutes, instead of very intense exercise for 45 minutes. You would also maybe consider letting the dog swim. If you have a swimming pool or you have a hydrotherapist close to you, swimming is a great low impact exercise for those dogs. And then obviously, if you've done exercise and you see the next day your pet is stiff and is painful, then you skip a day. You're never going to overtrain. You're rather going to do less is more, but you still want those joints to be kept going. You want the dog to be flexible. And obviously, exercise gives endorphins, and endorphins is going to make your pet happy, and you want a happy pet in the end.
Dr. Corinne Brink, you really are a dog's BFF, honestly, without a doubt. Thank you so much for all of this information. It's going to help so many people out there. You have been such an absolute superstar.
Thank you for having me. It was lovely.
I love it. Now, if your pet suffers from joint pain and you have more questions or concerns, you can engage directly with Dr. Corinne on the Ultra Pet website under the Ask Dr. Corinne section. So make sure you check it out because Dr. Corinne is there for you and your dogs.